I'm Dr. Bornali Dutta, Director, Respiratory Medicine, Medanta, the Medicity. The rains are upon us at the moment, and it is very important for us to be aware of all the respiratory problems that can come because of the monsoon season. Now, everybody who has underlying lung problems, for example, asthma, COPD, or any other chronic lung disease, they will be affected by any change of season. And monsoons especially, because of the air becoming much more damp and moist, and the walls will become damp, there will be mold in the air, fungus, it will lead on to problems. So it is very important for us to be aware of what to expect. So people who have underlying asthma, especially because they are allergic, and whenever the environment changes, like if there is dust or if there is damp, that will aggravate their symptoms. So they can get increased cough, they can get wheezing, breathlessness. So it's very important to be aware of it, to protect yourself and to stay away from anywhere where there is excessive moisture and damp. Continue to take your treatment. That is ultimately the most important thing. Do not stop your inhaled therapy, because the minute you stop, you will become much more susceptible to the environmental changes around you. The same goes for people who have bronchitis, COPD, emphysema, and this is again a condition related to people who smoke. And again, you're very susceptible to the environment. So do make sure that you continue the treatment you're taking and you avoid anything, going to crowded places, going to wherever there is water logging and things like that. Monsoons are also typically a time of the year which is well known to have a lot of infections, diseases, illnesses. Most of them are, of course, illnesses like dengue, malaria, and we know the precautions we need to take for that. But also because of the cold temperature, because of the moisture in the air, there is also a resurgence of viral infections at that time. Typically, viral infections are a problem of winters when there is cold season, but even in the monsoon time, viral infections are known to happen, influenza can happen, and you must just take precautions again. This is a time of the year when the temperatures suddenly change. From being very hot, it becomes cold suddenly, and we are all using air conditioners, and very easy to catch chill, because you don't know when to reduce the temperature that we have been used to throughout summer. So be very careful about that. Keep the air conditioning always at a very ambient temperature. Don't make it too cold, and then keep yourself well covered, with clothing wise, and keep yourself well hydrated, and that will make sure that you are protected from viral infections. Typically, viral infections are self-limiting infections. You'll have fever, you'll get sore throat, runny nose, a bit of a cough for 2-3 days, and you can take symptom relief treatment like paracetamol or steam inhalation gargle, and it will settle down for most of us. However, for those who have already existing lung diseases like asthma, COPD, chronic lung disease, other infections, tuberculosis, for them the symptoms may last longer, and it is advisable then to seek advice from your physician. It may be a respiratory physician or a general physician, but you must seek help if within 2-3 days things don't get better. Of course, we are all recovering from the effects of the COVID pandemic, and we know that it is not yet over. So whenever there is cold, there might be a little resurgence. So again, take all the precautions. You must practice the behavior that we learned during COVID, as in masking when appropriate, staying away from crowded places, hand hygiene, and these will be relevant for any respiratory illness, and you must make sure that you follow that. Thank you.